Welcome to the Pod of Inquiry. Ready for some thought-provoking cerebral whipping and the destruction of ridiculous medical dogma? Want to shift those stale, moldy old paradigms? Well then, don that thinking cap of yours. Get down in the cave and join our host, Dr. Stephen Barrett, for this week's episode. Let's start spelunking.
My guest today is Dr. Gus Vickery. Dr. Vickery is a very good friend of mine, and I've just enjoyed our conversations that we've had in the past. And I had to get together with him today to talk about something that I'm very interested in now, and that's ketone supplementation. So he explains not only the physiology of ketones, but also how they can increase your performance in many things, such as improving your cognitive capabilities, recovery after workouts, sports enhancement, and oh yes, how it can improve your sleep. So please enjoy this fascinating discussion with Dr. Gus Vickery. All right, everybody, welcome to the Pod of Inquiry. I am here with a good friend of mine and what I think is just a great colleague for referrals to my other colleagues because he's got such a grasp on basically all things biohacking and metabolism. And so Gus Vickery. Dr. Gus, thank you for coming on the show again. We had a great chat about peptides a long time ago, but it's been a while since we've had you back on. So can you tell everybody how to find your practice, what you're doing, how you got into this space? Because I think your story is very interesting.
Thanks, Steve. And it's really great to be back in a discussion with you. And I'm looking forward to the topic we're going to discuss today. Yeah, so I'm a physician. I'm located in Asheville, North Carolina. I trained originally in family medicine and started out with a traditional family medicine clinic that I started 20 years ago. And like many doctors of my era, we were still doing hospital work. We still took shifts in the emergency departments. We took care of our patients. When they went into the hospital, if they were in the ICU, we discharged them. We cared for them in the outpatient setting. We did that while we also ran clinics and saw people for day-to-day problems, wellness, et cetera. And so you get an enormous amount of exposure to a spectrum of health and a lot of different contexts over time. And as I continued to, see more patients over time and gain more experience, I became troubled by how unhealthy people were. It didn't make sense to me. And I don't even say necessarily unhealthy, just not feeling good, right? So young people who were coming in who, were getting diagnosed with fibromyalgia and migraines and mood disorders and sleep disorders and pain syndromes. And it was legitimate. They were suffering. They were experiencing these things. But the question was, why? When I was a 35-year-old, right, in a normal Homo sapien body with normal Homo sapien resiliency, why are they this miserable? And then, of course, all the people with chronic diseases that we were treating, new onset diabetes and dyslipidemia and vascular disease. So I began to get interested in kind of what's upstream of these diseases. Where is the problem in the human system? What's actually happening here? Because the health of the population I was serving did not match with my understanding of what I would expect for the health of a Homo sapien, right? Who with normal genetics, everything would be. And that's where I began to get into deeper study of nutritional biochemistry and molecular biology and geeking out on mitochondria and the autonomic nervous system balance and all things health. And the more I studied it, the more I began to realize that there are a lot of changes in our environment and our food and our habit patterns that have really thrown a wrench into our evolutionary fine-tuning of our epigenetic expression. And this is creating this pattern of health. So I just started with very simple interventions in our clinic, just coaching people on little lifestyle changes and, the real common sense type things and addressing nutritional deficiencies and insufficiencies that weren't being previously identified. And what we saw was that it worked. People got healthier. People began to stabilize disease states, at the very least stabilize them, so we weren't adding another medication. But in many cases, we saw with people who really dove in, we could reverse those diseases, especially metabolic diseases. And so it really started in that space, excess body fat, insulin resistance, diabetes, vascular issues. And over time, we saw we could clearly stabilize and possibly reverse those conditions. And then it just kept deepening from there. So now we're in this place where we've got a lot of tools that we use to assess a human system, and not everybody uses all these tools. But if I can, then we want to use where we measure body composition with DEXA and bone density with DEXA. We do toxicant assessments, full gut assessments, intracellular nutrient evaluation, cell membrane tests, mitochondrial function tests, full lab sets looking at immune, cytokines, oxidative stress markers, hormones, lipids. We do carotid intimal medial thickness to identify as the person. You get the idea, right? So we take as many pictures of that human system as we can to get the best interpretation of what's going on with their health. And then we begin to develop protocols for the areas where we find bad signal, so that we can say, can we fix that? And then if a person doesn't have any diseases or conditions yet, then hopefully what we're doing is pushing that way downstream, right? Because we're way upstream. And if the person is in a state of poor health, what we find is that we can get some restoration of that human system. So that's the kind of work I do. And I use because I trained in family medicine, I'm a generalist still, right? So there's no topic that I'm not interested in, and the toolbox is very wide and deep. The tools that we apply. We're going to discuss one unique tool today in our podcast.
So let me interrupt there, because that was an unbelievable flow on your metamorphosis, because you identified these things that if I make the human optimized, a lot of the chronic diseases that they may have will all kind of just wane away. Mm-hmm. And that's a very cool and different philosophy than most of medicine today. And most medicine is, let's treat the disease, and then one disease, one pill, one condition, one surgery. You're changing that, and I think that's very admirable, because now you're preventing. When you can prevent problems, that's the best way to treat it.
Yeah, no, it's very gratifying. I feel privileged and honored for people to trust me and to make these types of investments in themselves. And the transformations I've witnessed have blown me away.
Right.
It's about a confidence in human design.
Right.
We were actually designed to be highly resilient, robust beings.
Right.
When we're not, it's not a failure of our body, it's inputs, right? It's inputs that are harmful, or a lack of the inputs that are needed to maintain an optimal system. And a big part of what I try to do with individuals, the ones who come in who have been sick for a long time, that I think makes the biggest difference, is just restore their confidence in their body. Their body can restore health and orient to health, and to make sense of their health story, because they're confused by it. Like, they think, I just got a lemon, right? I was born into a lemon, and then I don't do it any good. It's my fault because I'm overweight, or this, that, or the other. And to help wipe that story away and say, no, here's really what's happened to the body. There are all these other things that you had nothing to do with, that you didn't know about, that were impacting. You didn't know that the lion's share of the food you were eating was lacking essential macro and micronutrients, and that your body was trying to survive on fumes when it comes to nutrients. You had no idea. No one's told you.
Not to mention all the crap that they're putting in it.
The poisons.
It's unbelievable.
You had no idea that you've been slowly poisoned from the time you were born.
Right. And I don't want to call out any specific baby food, but there was just a story on yesterday. One of the most popular baby foods is just loaded with all kinds of sugar, linoleic acid from vegetable and seed oil. It's just crazy.
And it probably has glyphosate and organophosphates and artificial emulsifiers and all kinds of other things that are just destroying that little child's gut.
Right.
Affecting the mitochondria. I know.
It's crazy.
To do from the time that they were born. If they were born after, say, the 70s, 80s, maybe 90s, if they were simultaneously being poisoned consistently every day, and simultaneously their body was lacking for the substrates that it actually uses to maintain health, like structure and function. What was that system? Of course it's going to deteriorate.
Right.
And when you help people begin to understand this and see it for what it is, and you restore their confidence in their body, then their willingness and power to change is impacted enormously. And so there's two parts of the equation. It's like, what can what tools and resources do I have? Peptides, therapeutics, molecules, pharmaceuticals, surgical interventions, where we
Right.
can really get some heavy lifting done in your system to reorient it. And then what's the part that you're going to have to do? Obviously, stop poisoning yourself, change other habits, etc. But if we do this together, your body, if we'll create a sort of an image of what it would be like to be in a great state of health for them, which is this very place for them. They want to be there. And I'll be like, I'm very confident if we do this together, you will arrive and be living in that place that you can envision for yourself. And it'll be a wonderful existence.
Well, I think it's so true, the power of human physiology, that if, I had a patient just yesterday that I saw that needs about 5 different surgeries, and she's just been in chronic pain. And I've been working quite a bit with her. And I said, listen, if I can get 1 or 2 of your 7 or multiple pain generators taken care of, you got a good chance that your body can take over and get ahead of the game here. And, she was thanking me yesterday, like, I didn't really believe you at first, but I'm doing so much better. And these other things are resolving. And I said, that's because of the power of human physiology. And if you just get out of the way and get a couple of the big, hurdles out of the way for the human physiology to take over, it's amazing. It's a miraculous thing.
It is. And your work has helped a lot of my patients who, had mechanical, like real biomechanical entrapment issues.
Right.
That I can't fix with peptides and molecules and things like that. And surgeons like you who didn't just, settle for what you had available, but went out and pioneered, have created a resource for our patients where problems that, again, I don't have the tools to solve can still be solved. So it's all of us working together, right? That ultimately makes this happen.
And quite frankly, Gus, that's the reason I send you so many folks, is because I know that I can't take care of a nerve out in their periphery if they're on fire metabolically. They have to be tuned in. And it's kind of like, you're going to paint a picture. Well, you want to paint it on the best possible canvas you have. And that canvas is human physiology. And that's why they need to get to people like you that will take the time and use the sophisticated, biometrics to look at what is it they really need. And I think that's what's so cool about what you're doing, is you're dealing with the metabolomics testing, all of these things that you're identifying these deficits in their physiology, so you can target that specifically rather than just giving a shotgun approach like, this is my diet that I recommend for everybody. Well, we know that isn't so good because everybody's not the same. They have different DNA, different metabolism, and so it's, I guess that leads into human performance. And what we're going to talk about today is ketone supplementation.
Yes. And just the final, put the cherry on the top, for you, for me, and for many others we know in this space, this is a really exciting time in medicine, like a really exciting time. The diagnostic capacities are expanding. The therapeutic options are expanding. I really am excited about what we're going to be able to accomplish over the coming decade.
And it's on a fast pace. I mean, just within the last 5 years, it's incredible.
Yes.
And
I mean, I look at my model from 5 years ago, the test that I was using, and we were helping people. Like we could measure, and people were being helped. And I compare it to what I have now, and I feel like it looks like I was working in the Stone Age or something. Right. And I know that 5 years from now, it's going to feel that way with what I'm doing.
Right. Well, let's talk about ketone supplementation. I had an experience a few weeks ago when we ran into each other out at the Hicks conference in San Diego, where I started dabbling with some of the ketone supplements, ketone esters, and I was shocked. I first of all, once you get past the taste, then you're off to the races. But so I got on the treadmill after supplementing with that, and it improved my performance by about 10%. And at the same time, it made it almost seem effortless. And I was shocked at how noticeable that was. So I want to talk to you I want to get into the science of ketone supplementation. Let's talk about the physiology some, and then maybe we can wrap it up with how to implement them into your regimen, your personal regimen, not you, but the audience's personal regimens for what they may want to enhance their performance.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor.
I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called STEM Regen, which I take daily and genuinely believe could revolutionize your health journey as well. STEM Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. STEM Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once unleashed into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating STEM Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that STEM Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first of its kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co/Dr. Steven, that's with a PH, and use the code SBPOD to get a 15% discount off your first order of STEM Regen.
Yeah, that sounds good. And what's interesting is what you said about how you could say, I had about a 10% performance improvement. I don't think you know this, but if you go into the studies, which have mostly been in fitness athletics, the measured improvement, say in endurance runners, is about 10%. So they are, but we're also talking about people you're a very healthy individual and you're very proactive. So you'd say you're pretty optimized most of the time. These endurance athletes are pretty fit people. So it's 10% for these, for folks who are already in a great state of health. There's a much probably higher percent improvement for people who aren't in a great state of health. And so we'll talk about that when we get into supplementation with ketones.
All right. So I guess my first question is, can you help the folks out understand the difference between ketone salts and ketone esters? Because that's really one of the they got to know what they're dealing with before they make a decision.
Yeah. And can I back up one step further and just real quickly delineate between being ketogenic and using ketones, right? So a lot of people get these things confused, and it's understandable that they do. Most people know about ketogenic diets. Ketogenic diets are diets that are designed to induce your body into a state of nutritional ketosis. That can be done through low calorie fasting or just simply elimination of most carbs and sugars, right? And your body will then begin to switch its fuel substrate to primarily fats. And as it's combusting fats, if you have minimal glucose coming in, and your body likes glucose, your muscles love glucose, your brain likes glucose. If you have minimal glucose coming in, then your body has a solution for that. It's really a survival adaptation, but essentially it'll take a part of the fats, the backbone of the fats, and it converts those. So it's just metabolizing the fats in the liver, breaking them up. It actually creates what are called ketone bodies. And then these are released into circulation. And a ketone body has 4 carbons on it. It's basically it's a hydrocarbon unit, much like a fat or carbohydrate, but it's a little different in its molecular structure. And then that can be utilized as a fuel source, as a substitute for glucose in the various tissues in your body, right? And it's not that ketones are a preferred, that's a semantics thing. It's not that it's like a preferred fuel. It's just another fuel. But it is, if ketones are available, your brain and your cardiomyocytes, your heart, will primarily utilize those ketones.
So isn't it true though that the ketones actually produce more ATP than glucose?
Well, they are more efficient.
Okay.
You get an improvement in mitochondrial efficiency of ATP production, yet, and they're also they lower in the studies. So I did a little bit of a dive into the studies on oxidative stress markers, and there are some aspects of ketones where they could be pro-oxidant, but ultimately, if you look at the mechanisms where ketones, they're signaling molecules, and the signaling effect is to reduce inflammatory response and reduce oxidative stress. So they're reducing cellular exhaust, right? So
Okay.
I mean, just to kind of go big picture, at the end of the day, in a mitochondria, which it's far more complicated than what I'm saying here, but essentially what you're doing in mitochondria, which is where you make your energy, you're taking hydrocarbon units,
Right.
fats, carbohydrates, protein, you're combusting them with oxygen, and you're making energy. Right?
Right.
Now, it's a lot more complicated than that.
Oh,
There's
yeah.
electrons and protons, but essentially that's
Yeah.
what you're doing. Much like a car engine is taking hydrocarbon units from petroleum and combusting with oxygen and making energy. Well, anytime you combust molecules like that and create energy, you create exhaust, reactive
Right.
oxygen species, unstable
Right.
forms of energy that and can be helpful in the right balance as signaling agents, right? They actually, well, this one, we don't want to completely eliminate all cellular exhaust.
Right.
But if you don't control exhaust production, eventually the exhaust will overwhelm the system and your energy production reduces, right? It bogs down. And that's where our bodies produce, superoxide enzymes, catalase enzymes, nitric oxide, glutathione, thyroredoxin, and they're doing a lot of jobs. So one of the jobs they're doing is they're clearing exhaust.
Right.
And so to the extent that you maintain a good, robust antioxidant system within the mitochondria and within your body, your mitochondria will be able to operate at greater degrees of efficiency, meaning they won't get bogged down. You can run more carbon through there and make more ATP. So ketones do produce a lot of ATP, but they also produce less exhaust, right? So they lower the oxidative stress burden on a tissue, which is one of the reasons they're thought to be so helpful for brain, especially after traumatic brain injuries, concussion, strokes, epilepsy, neurodegenerative diseases. Also, good studies on the heart demonstrating reduction of oxidative stress on the heart, and that they can possibly accelerate heart recovery from heart attacks or other or cardiomyopathies, that the heart will function better if it has ketones. It's debatable whether a muscle prefers a ketone or glucose. I balance. I think the muscles prefer glucose. They love glucose, just fast, quick energy, right? That they can utilize. But they'll use any fuel that is offered to them. But
so let me ask you a question, because I came across this and I was thinking about insulin resistance, and glucose has to have insulin to get it through the GLUT4 transporter into the cell and into the mitochondria. But ketones don't necessarily need insulin. They don't need insulin to get into the cell at all. So if you have an insulin resistant patient, does the ketones maybe give them a little workaround?
So that's one application is for individuals who have metabolic issues, insulin resistance, and obviously the fix is to reverse the insulin resistant state, which is a more comprehensive solution, mostly focused around energy balance, meaning their inputs and outputs and things like that. But while you're taking people through those types of transitions, bringing ketones in exogenously can be helpful. So ketogenic diets clearly are helpful for diabetic patients, right? They lower their blood glucose, their hemoglobin A1Cs improve. And one of the studies I referenced specifically looked at oxidative stress markers in diabetics and showed that and this was really in nutritional ketosis. This was just being on a ketogenic diet. Now, if you were a diabetic and you didn't change anything about your diet and you were eating muffins and bagels and brownies and you just throw some ketones in there, well, you actually may get some slight performance improvement because you put ketones in there, but you're not really going to do anything about your insulin resistance. If you did that, you would be if you're really using ketones for performance, and I'm getting a little off topic here, your ideal environment is carbs and ketones, right? Like that's not weight loss. That's not reverse insulin resistance. That's performance right there. Like we've got carbs and ketones, which is where these exogenous ketones, these ketone supplements come in for as performance enhancers, but they're also really important tools in helping people transition their body into better health. It can really help smooth that process out. But there's a big difference between going into nutritional ketosis, where you're in a distinct physiological state, that to some extent is a survival state, but we probably spend a good bit of the time in our hunter-gatherer days in ketosis, right? So it's not a bad way to live, but ultimately, if you stay in ketosis long term, we do see possibly downregulation of adrenal hormones, thyroid hormones, reproductive hormones. To me, that indicates that the body over time reads a persistent ketosis state as we really don't have access to other sources of food, right? Like we are completely dependent on killing an animal, as opposed to environments where you had fruit available, or you could dig up tubers, or and you go back 10,000 years and we begin to have the advent of agriculture. And 10,000 years is a pretty good bit of time for selective adaptations to occur. That's why and so it's not that carbs are bad or like they're a monkey wrench. I think we've adapted to carbs, and I think there are reasons why people who are metabolically healthy often will perform better and have healthier hormone balance and feel better and better moods and better neurotransmitters if they are including complex carbs in their diet. So, but whatever the case, there's a difference between saying I'm going to be on a ketogenic diet and go into ketosis versus whether you're ketogenic or not, I'm going to take exogenous ketones. When you take exogenous ketones, if it's the right type, and we'll talk about esters versus salts, and you have a ketone meter, you should measure that you've gone into a state that you've got ketones, right? That's what you're measuring. I can measure blood ketones. Like there are ketones. That doesn't mean you're in nutritional ketosis. That means you've just dumped it, put into your body ketones, which then become this additional fuel source that can be advantageous for performance.
So let me ask you a quick question. Let's assume that you're getting the right amount or an amount of complex carbohydrates, and then you start just day-to-day regular living. Does the body have some kind of a homeostatic mechanism where it will shift to maybe more ketone production, or is there just a sub level of ketone production endogenously, or is it just when you're in that starvation mode that we produce ketones?
That's a great question. One I don't think I can answer with. I don't have because I can give my educated guesses about what you're talking about, but I don't think that I can answer. I do believe that for people who have a healthy body composition, who are metabolically flexible and in a good state of health, who probably also don't eat the same volume or frequency of food as everybody else, if they're in that state, like their bodies are more efficient, they don't need the same amount of food as other people, they can go further on less, that they're probably dipping in and out of ketosis, just depending on how long it's been since they last had a meal. But it would be considered like a mild ketosis, meaning that maybe if you used a meter, maybe you're 0.6 or something like that in terms of your measurement. But yeah, I think that the body is very, if you're metabolically flexible, I think your body can switch gears very quickly. Like, okay, we're combusting mostly fat. We don't have a whole lot of glucose. We haven't eaten in 8 or 10 hours, right? So we're out, we're depleting glycogen. Oh, we'll go ahead and we're going to go ahead and start producing ketones so that the brain can continue to utilize those. So I think it's a state that healthy, metabolically flexible people who aren't overfeeding are moving in and out of. Now, a high-performance athlete might be eating 6 meals a day and still be very lean and metabolically healthy and even metabolically flexible, but they're probably not going into ketosis at all because they're getting all their fuel is coming in consistently without any substantial gaps. On the other hand, somebody who has been overfed and possibly is overweight and has insulin resistance and has been in this state for years begins to go on a low-calorie diet or a ketogenic diet, it may take weeks for them to be able to measure that they've gone into ketosis because I think that the system has been down-regulated. Right? It's not been utilized for a very long time because this is a person who hasn't gone without a meal in years or decades.
Right.
And obviously the body is into conservation of energy, and it's going to downregulate genetic expression and protein and enzyme creation for any function that's just not being used at all. Right. And so that's where people end up in these states where we call them obligate sugar burners. They're not. They're combusting and using fat as an energy source as well. They're using both, but they're not producing ketones. They're not moving into that type of state. And even if they go for a prolonged fast, it can take some time for their body to finally adapt and then upregulate the mechanisms and put them into ketosis. That's where also, though, in those cases, that's where giving people exogenous ketones through those first few weeks can help them feel much better while they're waiting on their body to produce its own ketones.
All right. So that brings me back to the question, ketone salts or ketone esters?
Yeah. So ketone esters for sure. Right.
Okay.
So the reason that ketone salts came to the marketplace is that ketone esters were not available. And when they first came available, they'll never taste good. I mean, I don't want to say never, but it's going to be a long time before they taste good. So everybody just has to reconcile themselves. If you want to use this tool, you're going to scowl when you taste it. But then just drink something, chase it. It's not that bad. It's like taking a bad cough medicine or something. It's just like, you know? But they don't taste good. But the original versions, the first versions, which were not that long ago, were like horrific, like jet fuel like experiences. Yeah. And like one portion of ketones was like $50, right?
Wow.
So it's just not useful. Now we're at a place where there are multiple entities producing ketone esters, and they're reasonably affordable. Like you might be able to have a 3-gram portion for a couple of bucks, a few bucks, right? A 3-gram portion is a low dose, but it's enough of a dose to actually put you into a mild ketosis state. Well, again, not truly in ketosis, but to be able to measure ketones, at a mild level in your bloodstream. So the salts came out of the marketplace, and the salts essentially, or they're delivering it through the gut bound to these salts, but you get this very high salt load along with it. And just to go ahead so the listener knows, if you're going to do this and you're going to check your ketone levels, and I suggest you do, there's multiple meters. Keto Mojo is a good one. It's very simple to use because you do want to know how your body's responding. There's a target range you generally want to stay in. Like if you want to get performance enhancement, you want to be over a 2, and then you want to kind of stay between 2 and 3.5. Right, okay. That's kind of like a good moderate to deep ketosis state that's healthy for you. There's not a lot of studies on what it looks like to be in a deeper state of ketosis for an extended period of time, which I would consider sort of an abnormal signal to the body. So we want to stay in the realm of how the body was designed. So 2 to 3.5 would be kind of your target range. Well, in order to get to that range with a ketone salt, you had to consume a boatload of salt. So if you have salt-sensitive hypertension, you have kidney issues, you have anything else, that's a problem, plus the gut distress, plus the ketones, the actual beta-hydroxybutyrate was both isomers of it. That's a chemical term. But essentially, and one of those isomers is not good for us and the other is. And so you had to get both in the salt. So when the ketone esters were finally able to be produced at a level that the price was reasonable, and again, the flavor will never be good, they're a much better solution because it's essentially you're getting beta-hydroxybutyrate. You're dropping it right into your system. It has an ester attached to it as part of how you deliver it. But our bodies have just a healthy abundance of what are called esterases, enzymes that cleave esters. And so it's released and it works and you can measure it. You can take a shot and you can use your ketone meter 30 minutes later and see, hey, wow, I'm at 2 right now. And I ate carbohydrates for breakfast, right? And here I am with a measurable level of ketones in my bloodstream. So I would, at this point, with the availability of ketone esters at reasonable price points, I would suggest that the salts would be. There's no reason to go down that road and use them. But there is another. I don't know if you want to get into the products that are using butanediol as their primary source of ketones or not. If you want to even bring that up.
No, I think that'd be great because I think what you just laid out there. Now with the ketone esters, they're both isomers. Still, or is it just preferential?
Yeah, no, with the esters, you're getting only and I can't remember if it's the L or the F. I can't remember which S isomer it is.
Okay.
But it is the isomer that our bodies use.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor.
The power of ketones, your body's alternative fuel.
The folks at Approved Medical Solutions have done it again. That's right, with their new Clean Ketone Supplement. Imagine your body as a hybrid car capable of running on 2 different fuel sources. These molecular powerhouses cross the blood-brain barrier, providing crystal clear mental energy that many describe as enhanced focus and clarity. But ketones aren't just brain fuel. They're efficient energy sources for your heart, muscles, and other vital organs. Think of ketones as premium grade fuel that produces less metabolic waste than glucose processing. Research suggests ketones may offer additional benefits: reduced inflammation, improved metabolic health, and even potential neuroprotective properties. Approved Medical Solutions Clean Ketone Formula contains nature-identical ketones. I've been using them regularly now and notice a minimum of a 10% increase in exercise performance. To get started, go to approvedmedicalsolutions.com and use the code SBarrett to up your mental and physical game now. So are ketone esters then a little bit more bioavailable than a ketone salt?
Yeah, absolutely.
Okay, so not only are you not having to get the salt overload, you're getting a little bit better bioavailability.
Yeah, you're going to be able to get it. You're going to, okay, for purposes of making this conversation, I'm going to refer to it as being in ketosis. But technically, you're not really in a true ketosis state. You've just got ketones in your bloodstream.
Right.
But to get into a good level of ketosis, the esters will get you there. The salts, it's very hard to get there without going through either a heavy salt load or gastrointestinal or what have you. Now, the old school was medium chain triglycerides, MCT, which are still used.
Right.
Or caprylic acid, right? And that's, an 8 carbon chain. It's the saturated fat, but that has to be bioconverted. Some people do that bioconversion well. Some people don't do that bioconversion well. So the efficiency varies. You'll never get, it'll be very hard to get into this state of ketosis a ketone ester will put you into with an MCT or caprylic acid product. Some people get serious gut distress with those products. Yeah, really bad gut distress. And for some individuals who have strong genetics to minimize saturated fats, it's still a saturated fat and can have a metabolic effect. So while I'm not against MCTs being put into a coffee creamer or something like that, and maybe that's helpful, I think if you're going to explore ketones for any reason, medicinal, performance, athletic performance, mental performance, recovery, sleep, these smart choices are the ketone esters. And I have no investments in any ketone companies, just so people know. I have no financial incentive whatsoever to promote an ester or everything else. It's just the best product in the marketplace right now.
Right. So what does the ketone ester supplement do necessarily to the gut microbiome? Because I understand that there's a lot of beta hydroxybutyrate that is made in the gut microbiome itself from different fermentation processes or things that are going on at that level. Is that true or not?
There's really no evidence of any kind of detrimental effect to the body.
No, I'm talking about a beneficial effect.
Yeah. I don't know that there's a big beneficial effect either. Okay. Obviously, there are species of microbiota that probably use ketones. But there's not any evidence that you'll get a more diverse gut biome by supplementing with ketones, and there's no evidence that you'll get a lowering of diversity or challenges. There have been studies with ketogenic diets and the gut biome showing that there are clear shifts in the microbiota, which makes sense. But that they're not necessarily resulting in poor health outcomes if it's a healthy ketogenic diet. So in the case of supplemental ketones, I don't know they could exist, but I don't know of a study where they actually were assessing gut biome impacts. So I would just say it's probably neutral.
Interesting. Has there been any work? For some reason, I recall seeing some stuff on MCT that might be beneficial to the gut microbiome. But
I mean, I think ultimately when you're looking at the gut, the more diverse, as long as it's not poisonous and unhealthy, but the more diverse the forms of energy and nutrients and molecules that you're putting into your gut, polyphenols and anthocyanins and various sizes of fats, then more than likely you're going to have in a healthy way a more diverse biome and a more balanced biome, because diversity creates balance as well. I'm speculating. I want to be clear. I'm speculating. I'm not a biome expert, although we do biome studies in my clinical practice, and we try to create an ecosystem that'll promote a healthy gut biome shift for our patients, because that's critical. But I wouldn't personally add MCTs just to create a healthier biome. That wouldn't be
No.
an intervention. The same way that I would say use prebiotic fibers or resistant starch or some other
Right.
things in bone broths that I know benefit the gut.
Right. Well, you just see so many things out there. I had to ask you because,
Yeah. And it could be
Yeah.
that MCTs, that there are certain strains of bacteria that respond really well to that are good
Right.
guys that you would want to promote. Again, I would look at that as like you're trying to nudge it a little bit, as opposed to like being able to really shift it in a direction. Yeah.
All right. So Gus, you mentioned something that I've got to pick up on, because one of my biggest challenges in the health arena is sleep. Okay. And you mentioned that sometimes you'll take a ketone supplement to enhance your
I'll take
sleep.
it every night.
Do you
sure.
really?
Absolutely.
Tell me a little bit about that. I would think it would just amp you up.
No. So the dosing is critical, right?
Okay.
So the dose you take for sleep is different than the dose you may take because you got 3 hours of intense focus where you're about to go run a race or something like that.
Right.
So I take a 3 milligram dose. So with the product I use, that's a 5 milliliter, but it depends on the dilution of the product that you're using. So I take a 3 milligram dose at bedtime. Some people
you're saying for the guy that wants to get on the treadmill or go run, that's a 3 gram dose?
No. So the 3 gram dose, sorry, not 3 milligram, 3 gram dose is a bedtime dose.
Okay.
Now that can be for some people. Again, this is like if a listener to this podcast says, I'm going to play with ketones,
right,
get a meter and pay attention to your levels and how you feel. Like really become train yourself in your response, and you'll become really good at knowing how to use this tool, when to use this tool, when is it benefiting you, when is it not, and what are the dosing thresholds, because the dosing will vary for individuals. Some people will find that they sleep more deeply and recover better at a 5 or 6 gram dose.
Okay.
For me, it's 3 grams. If I go up to a 6 gram dose, my brain wakes up and wants to work. Right.
Okay.
So
right.
it's a delicate balance there, but at 3 grams, and there's a good study on sleep and sleep metrics. Deeper sleep, lower oxidative stress in the brain, clearing of toxic metabolites. Recovery is accelerated, like deeper, more, like your brain recovers better overnight if you have some ketones available to it.
That's very, I think that might change my routine tonight.
Yeah. No, I take a 3 gram dose at night.
Yeah.
I take a dose before I work out, but like more of like a 6 gram dose.
Okay.
I then take another 3 to 6 grams after the workout because of the recovery data. And then I'll take another dose. I just took maybe a 3 to 5 gram dose right before this podcast. Because
interesting.
I've done a couple consults. I've been working. I've already done a workout today, a physical workout. And I'm like, hey, you know what? I don't want to feel like my brain starts to lag during this podcast. So I'm just going to go ahead and take some extra ketones.
Now, are you taking creatine too after the
I always
workout?
take creatine. Creatine's in my top 5. Put me on the desert island and you give me an unlimited supply of 5 things. Creatine is one of them.
Interesting. So no problem. Creatine and the ketone.
Oh, no, synergistic.
It's synergistic, a good stack.
Yeah, good stack.
Yeah. Awesome.
Yes. Yeah.
Well,
so sleep, there's clear data.
Right.
And then subjectively, just an enormous amount of anecdotal data. And I would encourage anyone to consider, just trying this. If nothing else, for sleep. I'll have patients who maybe they don't want to spend the money on them. They're still not cheap, but they're not like this expensive as they used to be. Like, just take a dose at night for sleep. Certainly, and anytime you feel like your brain has been overworked and needs enhanced recovery, ketones, it's an incredible tool. It's like one of the top few things on my post-concussion or post-traumatic brain injury protocol. Anytime there's been brain injury, immediately ketones. It just dawned on me last night watching my son's basketball game. He's varsity now, and he's 6'5", and they're all huge. And I was like, oh, I'm going to have him start taking ketones before his games. Possibly to help with his mental focus, but also in the event that he gets a knock in the head or something like that.
Right.
We've already got this happening. And this was an interesting study that they did in soccer players looking at because, one way of measuring performance is, oxygen utilization, ATP production, race
Right.
times, sprint times. There's a lot of studies looking at those, and we see these 4 to 10% improvements in these individuals who are already well trained and, kind of optimized. But really, my thought has always been more on not that the extra energy substrate is going to get you more mileage out of your muscles. It's actually going to get your brain more focused and staying more alert and into what you're doing, and you're going to be able to push through mentally. I really think that's where the power of the ketones are, more than, say, fueling muscle. And so what they studied is the number of mistakes that
Okay.
a player would make.
Yeah.
And towards the end of any competitive match is where the mental mistakes happen more frequently than earlier, because you're tired, right? And then also those tend to be mistakes that are like critical mistakes. So a soccer player is trying to clear the ball, but actually turns it over to the other side and they score a goal,
Right.
or like that. And they saw a 50% reduction in the number of mistakes in the players that used ketones.
That's really interesting, because just hearing that, you recall some of the games that you watched, and they'll be 0-0 until the 89th minute, and then all of a sudden there's a goal scored right before it.
Yes.
Yeah, that's interesting. Yeah.
And so that's, I think, to me, that's where the money is with these things. We may find out later that there were these amplifications of muscle performance and muscle endurance and stuff, but I personally think it's that your brain is, still using glucose, but it's oxidizing these ketones. You're lowering oxidative stress. You're lowering inflammation. Your brain is working at a more efficient level and able to sustain that for longer.
What about VO2 max? Any studies showing?
I haven't seen any studies showing a change in VO2 max.
Right. That'd be an interesting metric to look at.
Yeah.
So,
yeah.
All right. So we've got potentially a sleep enhancement from the supplement. Clearly,
definitely a recovery enhancement post-workout. Yeah,
okay. And then cognitive. There's no question about that.
And by the way, there are studies showing that you do get after workouts, after doses of ketones, but amplified with workouts, increases in EPO production. Right.
Okay. Right. Yeah.
Now it's only for a few hours.
Right.
And so that's not that meaningful if it's just here or there, but if it's consistent over time, that could be meaningful. And also angiogenesis in muscles. So there are some, it's soft data, but there's some compelling data that you will recover from whether muscle workouts or endurance workouts faster with ketones aboard.
Interesting. So you're doing both the ketones before and after the exercise, in addition to your creatinine, and that's kind of an interesting stack. I'm going to have to think about that a little bit more. Anything else on ketones that the average person who's been kind of had a little bit of an interest in, that's like, okay, this is why I should maybe look at this.
Let's talk about the different applications, like where they can definitely be useful and where there's evidence that they're useful. So we've already covered deepening sleep, better sleep. We've covered the recovery aspect. We didn't go into the detail for performance, but essentially if you put ketones in, there are some possible performance benefits for your workout. And we talked about this too, like the ultimate environment for that. If you're if you're a CrossFitter, you're weight training, you're endurance athlete, and you aren't trying to lose fat, you're already in a body comp that you want, you're just really pushing into fitness, is that you have both carbs and ketones available. So you would have both your carbs and you would have your ketones, and that's for optimal. But then there are individuals who are trying to lose body fat, right? And so they're gonna work out fasted. So that's a great time to use a ketone, right? So if you go into a fasted workout and maybe you're working with less glycogen or low glycogen, meaning you don't have a lot of glucose, ketones absolutely will give you more power in your workout. You'll be able to go deeper into it and perform better. So that's a great application. But again, if you're already where you want to be body composition wise and you're really just trying to push fitness thresholds, then you want carbs and ketones together. If you're actually on a body composition protocol where you're trying to lose body fat and preserve muscle, then just fasted with the ketones. That will help you. But also as a replacement for caffeine for many people who are realizing I need to use less caffeine.
Right.
But they're looking for tools for mental alertness and focus. I would say try a 3 to 6 gram dose of ketones, or even a 5 to 10 gram dose if needed. And stay away from the caffeine and observe the response. And a lot of people will notice that they don't feel like later that they needed any caffeine.
Right.
And so, caffeine, there's always a downside to it, right? There's an upside and there's a downside. With ketones, there's no downside.
Right.
You're just, right. And then you have hunger management.
Right.
So
Right.
for individuals who are really trying to dial in their diet, they're trying to deepen fasting states. If they're trying to, lose body fat, and they're on a low calorie diet, and there's just windows of time where they're going to get really hungry, and they know that, which is a little different than, say, a craving. Like, it'll give you some leverage on a craving, but if you've got a serious sugar addiction and someone puts your favorite form of sugar in front of you, the ketone may or may not make the difference in what you do. That gets back into willpower, self-control, control of your environment. But when it comes to like standard hunger signaling, you can mute that out to some degree with a dose of ketones. And so that's a really good tool for people who are transitioning onto low calorie diets for purposes of body composition improvement, is to give them ketones, especially during the adaptation phases until they have kind of mastery over it.
One question on the sports performance is the use of ketone supplements like we've been talking about, is that banned by WADA or any of the?
Not at all.
So it's just it's a clean way to enhance performance if you're a competitive athlete who's being tested.
If I was right now a billionaire owner of a professional basketball team,
right?
Okay, and I had these $100 million assets, right? For my players.
Right.
I would absolutely have invested in a protocol. It'd be optional for the players, take it or leave it, but I would have my players on ketones, right? Before their games, after their games, at night, after I would absolutely, and it'd be, and I think that team, their players you'd see upticks in performance, but you'd also see faster recovery, less downtime, less health impacts from the challenges of the lifestyle of being a professional basketball player. I would absolutely make that investment compared to what you're spending already to own a basketball team. The cost of just giving them all a supply of ketones for the season.
Exactly. Right. Instead of that big jug of Gatorade behind the bench, you could just have that, a smaller jug of the ketone supplement. But
absolutely.
Yeah. Gus, thank you so much. I always love hanging out with you because I learned so much, and I know the audience is going to love this great conversation that we just had. And I hope that we can talk about some more things in the near future. Thanks so much.
Well, thank you, Stephen. It's always a delight too. And the last thing I will say, we focus mostly on performance or niche uses. If you have, or your loved one has a neurodegenerative disease, traumatic brain injuries, a cardiovascular disease, cardiomyopathies, I would strongly consider getting them onto ketones on a consistent basis. It should allow those tissues to heal better, perform better, or at least slow the progression of their condition.
Thanks so much, Gus. I appreciate you.
Thank you, Stephen.
All righty.
Well, folks, if you are over 40 and you are not using a supplement to augment nitric oxide production, you should really rethink that. This molecule is absolutely imperative to the health of so many bodily functions, not the least of which is cardioprotection. If you have any question on nitric oxide, I suggest that you register with Approved Medical Solutions and begin receiving their educational emails. I never miss a day of nitric oxide supplementation. That's how important it is. Long overdue, Approved Medical Solutions created the only nitric oxide replenishment formula without oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett at checkout, and you'll receive a 10% medical discount savings. You can register to receive educational emails without any purchase. For licensed practitioners, you too can go to approvedmedicalsolutions.com and get registered today. They have unique bundles for all of the full-fledged spelunkers of the Pod of Inquiry. Use Pod of Inquiry at checkout after registration. Here's a little secret. If you order their testing strips and test every patient for 2 clinic days, you will see every one of them be efficient. When they see this result, they will want you to start them up immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates.
I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex, please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.